Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Longitudinal Assessment of Chemotherapy-Induced Alterations in Brain Activation During Multitasking and Its Relation with Cognitive Complaints, by Sabine Dupre et al. My name is Brenna McDonald, and I am Associate Director of the Center for Neuroimaging and Associate Professor of Radiology and Imaging Sciences and Neurology at Indiana University School of Medicine, Indianapolis, Indiana, USA. My oncologic specialty is the study of neuropsychological and neuroimaging effects of cancer and its treatments. Since the 1980s, researchers have been investigating the potential biological basis of cognitive symptoms reported by patients during and after treatment for non-central nervous system cancers. Previously, patients might have been counseled that these symptoms had a purely psychological basis, but researchers have since demonstrated that objective and subjective cognitive symptoms can be linked to cancer treatment. While such symptoms may be subtle by clinical criteria, with scores often falling in the normal range, these changes can have meaningful relevance for patient quality of life. It can be difficult to detect these differences using standardized neuropsychological tests, but advanced neuroimaging methods may be more sensitive to such subtle effects. Most recently, structural and functional neuroimaging techniques have shown that both objective measures of cognitive function and subjective report of cognitive complaints correlate with alterations in brain gray and white matter, as well as changes in brain activity after cancer treatment. The majority of this work has focused on chemotherapy effects, though some work has documented differences in cognition in cancer patients prior to systemic therapy, suggesting potential effects related to the cancer disease process and/or host factors. In addition, smaller bodies of work have examined the potential cognitive effects of other aspects of cancer treatment, for example, surgery, anesthesia, radiation, and anti-estrogen treatment. Given the high incidence of breast cancer and the large and growing number of survivors, the majority of this work has been conducted in this population. In this context, Dupre et al. Utilized a prospective longitudinal study design to investigate the relationship of cognitive complaints to multitasking performance and brain activation in women treated for breast cancer. Dupre and colleagues studied 18 female breast cancer patients prior to starting chemotherapy and 4 to 6 months after treatment completion. 16 patients who did not receive chemotherapy and 17 matched healthy control participants were also studied at matched intervals. As cognitive functions like multitasking are among the most commonly reported areas of concern after cancer treatment, participants completed a functional MRI or fMRI multitasking paradigm in a 3 Tesla scanner. Briefly, the fMRI task included 2 cross-modal single-task conditions consisting of auditory and visual one-back working memory tasks, as well as a dual-task condition combining these 2. The multitasking condition included both the dual task condition and a short-term visual memory task. A novel aspect of this study was that the investigators controlled for task performance by adjusting task difficulty during training in order to obtain 70 to 80% correct responses during the scan. By equalizing task performance across treatment groups, the investigators were able to prospectively control for performance accuracy as a contributory factor to the activation findings. Cognitive complaints were assessed using the Cognitive Failure Questionnaire. Consistent with these authors' prior work in healthy controls, the multitasking condition activated a bilateral frontoparietal, cerebellar, anterior cingulate, and occipital temporal circuit in all groups. No between-group differences in multitasking-related brain activation were found at the baseline scan. Chemotherapy-treated patients showed decreased activation in task-related brain circuitry from pre to post-treatment, specifically in the left anterior cingulate gyrus and intraparietal sulcus. No such changes were noted in the other two groups. Interaction analyses confirmed this finding, demonstrating decreased activation from baseline to post-treatment in chemotherapy-treated patients relative to controls in the left anterior cingulate. No increases in activation were seen over time within or outside of multitasking circuitry in any group. There were no significant differences in task performance accuracy or reaction time between groups, though all groups showed significantly improved accuracy and reaction time at follow-up relative to baseline. Analysis of cognitive complaint data likewise showed no baseline differences, but demonstrated a significant increase from the first to the second assessment only in the chemotherapy-treated group, as well as a significant increase over time in chemotherapy-treated patients relative to controls. Increased cognitive complaints were found to correlate with decreased brain activation in multitasking circuitry, specifically in the left anterior cingulate and inferior frontal sulcus. This relationship was only observed in the chemotherapy-treated group. The authors interpreted these results to suggest that changes in brain activity may underlie cognitive complaints after chemotherapy treatment, and hypothesized that these changes might be due to damage to task-related brain regions or reduced regional connectivity attributable to chemotherapy. They comment that previously observed treatment-related alterations in brain gray and white matter structure in components of multitasking circuitry may underlie the observed reductions in task-related brain activation. These activation changes may in turn lead to reduction in self-perceived cognitive efficiency and increased cognitive complaints. Given the equalization of task performance between groups, the authors noted that these changes were unlikely to be attributable to differences in task effort or strategy use. As no longitudinal changes were seen in activation on either of the single task components, it was felt that the findings could not be attributed to chemotherapy-related alterations in the hemodynamic response. Self-reported depressive symptoms likewise did not account for the observed activation changes. While the current study did not demonstrate the baseline differences in activation in cancer patients shown in other work, the authors note that their sample was considerably younger than those previously studied, and may therefore have had greater cognitive reserve, which may serve to protect against cancer-related brain changes. The process of prospectively controlling for task performance may also have affected the pattern of between-group differences in brain activation. This is the first published study to demonstrate a longitudinal relationship between changes in brain activation during multitasking and cognitive complaints after chemotherapy. These findings demonstrate treatment effects on a putative neural circuit underlying cognitive complaints after cancer chemotherapy, with activation changes particularly evident in brain regions thought to be important for attention and working or short-term memory. The results of this study offer additional validation of the concerns often reported by patients. Longer-term follow-up studies will be needed to monitor the course of these symptoms and functional brain changes over time. It will also be helpful for future work to further examine the relationship between task difficulty, performance accuracy, objective and subjective cognitive functioning, and brain structure and function. In addition, larger cohorts, perhaps via multicenter studies, will be needed to determine which patients are most vulnerable to such difficulties and why, through study of demographic, genetic, and treatment variables which may play a role, as well as to examine the potential cognitive effects of other aspects of cancer treatments aside from chemotherapy. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.